living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Community health centers play an important role in Montana, Wyoming, and across the country. Their mission is to promote quality health care to everyone, especially those who are underinsured and medically underserved. On today's show, we'll learn about the history of community health centers, what they have to offer, and why they're important to our communities. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back to Healthy Living for Life. Before we start our show today, we're going to first play a short clip about the history of community health centers.
It all began 50 years ago as a modest social experiment during America's war on poverty. The goal? To bring doctors and primary and preventative health services into poor urban and rural communities, places where health needs were neglected and ignored by mainstream medicine. A revolutionary partnership was created, bringing together for the first time reform-minded physicians, nurses, local community leaders, and the federal government to build a new type of community-based health care. It would serve all people, no matter who they were, where they lived, regardless of income or insurance status. And it would empower and give voice to people living and working in those communities to direct how health care was to be delivered. That small investment 5 decades ago has saved countless lives and strengthened thousands of communities. Today, community health centers stand as the largest and most successful primary care system in America.
As you just heard, community health centers play a large role in providing health care in our country. Joining us today is Cindy Sturgar, the CEO of the Montana Primary Care Association. Thanks for joining us today, Cindy.
Thank you, Sarah. It's great to be here.
So let's start off talking about how many community health centers are in Montana.
So the community health centers, there's 17 organizations that have over 70 sites, so places that they deliver service in Montana.
So how many Montanans actually access community health centers, or CHCs as I call them?
Right, so we've been around in Montana for over 40 years, and last year in 2017, 107,000 people got their care through one of those sites in one of the community health centers in Montana. So about 1 in 10 people in Montana get their primary care with community health centers.
How does the Montana Primary Care Association relate to community health centers?
So just like other people have systems of care, or you have a teachers association, we have a primary care association. So we're the association for the state, and our members are the community health centers, and other people who might provide primary care are partners that we work with in the state. So we do a couple things with our members. We do a lot of training and technical assistance. We're always looking at how to improve access, how to improve quality, and how to improve operations. So that's a main tenet of what we do as a primary care association. And then the other side, of course, any of us in healthcare are looking at policy. So we're always looking at policies that impact vulnerable communities in Montana. So we're very concerned about insurance, we're concerned about coverage, we're concerned about access, right? If somebody lives far away, can they get somewhere? How do we make sure they get there for care?
I understand that you offer sliding scales for payment of services. Can you talk about that?
Right, so the community health centers in Montana are all independently owned, but there's over 9,000 organizations in the United States that are community health centers. And all of us have a sliding fee scale, because one of the barriers to care, one of the reasons people don't go to get care is that it may cost too much for them. So if they have no means of paying, it's really important that we say, we don't want that to stop you. We have a sliding fee. So based on your income, you will be charged accordingly. So we don't make that up. That comes from the federal government, and it's readjusted every year. But for example, if you're a person, one person, the minimum or the 100% of poverty in the United States is around $12,000. So if you make less than $12,000, you would probably have your bill slid to a very low cost in a community health center.
And so that would be $12,000 per year, right?
$12,000 per year. So many of us have lived at $12,000 or under per year in Montana, especially if you work part-time. Almost everyone we see works. It's just how much they're making and how big their family is. So that's a big tenet across the United States in every community health center.
Something that seems a little confusing to me is the terms community health center and critical access hospitals. So can you talk about the difference between those two entities?
Yeah, it is confusing, especially if you're in a community and you really don't care what the name is of something, right? But in essence, a critical access hospital is a hospital-based system that is based within patient care. They may do other things, but they start as being an inpatient care facility. And community health centers start with being an outpatient primary care center, and they do many things too. So their origins are different. They may oftentimes partner with each other, but they're very different as far as how they started.
The community health center, or CHCs as we're calling them, can they provide more affordable care than hospitals typically?
You know, that is a question I can't really answer because it really depends on the locality. But usually what happens is that inpatient care costs a lot more because it's 24/7. Outpatient care does not. So the goal in primary care is to try to keep a patient healthy and hopefully that they don't end up having to have inpatient care. Most of us don't like to go to hospitals, nothing about the hospitals, but most of us like to be healthy. So the whole goal in primary care is to keep you as healthy and functional for as long as you can be. So our goal is a bit different than an inpatient facility. So often, because of that, our costs are less. Overall, not for a specific visit, but overall, our cost to healthcare system is less.
Very good information for sure. We'll pause here for a short break and we'll continue this conversation after these messages. Stay tuned. Welcome back. We're continuing our discussion with Cindy Sturgar, the CEO of the Montana Primary Care Association. In the previous segment, we talked about how community health centers provide services to the underinsured or uninsured, and how federal funding helps community health centers provide those services. Welcome back, Cindy.
Thank you.
What is the percentage in Montana of federal funding revenue for community health centers?
So it's different for every community health center. So depending on when you started, you may have had a grant, and at that moment, that grant might have been 60% of your funding. And as you continue to mature and provide services, it may be a much smaller percentage. But today in Montana, we receive about $35 million in federal funds to help make sure people have access to primary care in the state. So it's just different. We have big centers in Missoula and Billings and very small centers in Chinook, Hamilton, some of the smaller communities.
So I understand recently, and it's been in the news, that Congress reauthorized some funding for community health centers. And I'm sure the issue of not authorizing that funding had to have caused some heartburn. Can you talk about that?
Yeah, it sure did. So if you start a business, like any small business, and you are running off a certain revenue and all of a sudden that revenue stream gets stopped, it puts a hold on a lot of planning and expansion. So for some of our smaller sites, they were quite concerned that they may have to close because it was a large percentage of their revenue. In our larger sites, they were probably, their revenue was more robust, but they had to hold back on expansion. There was concern on hiring folks because people were hearing things in the media and wondering if the place they might want to go work might not have the base funding that they needed. So there was a lot of serious concern, both in the public, in the staffing, and of course the administration of those organizations, trying to make decisions about future needs, knowing that your revenue was uncertain. So that took almost 8 months before Congress came to resolving a part of that. There's still a small piece of that that's still unresolved, as it is for everyone. There's still a continuing resolution right now, but hopefully that's going to get settled out this month, and we'll move forward in a full budget. But it was very disheartening to go through that waiting period with Congress right now. Our goal is always to provide access to all of our patients, and health care is such an important right for folks in our communities that to create a scare around that was a little frightening for people. So we will continue with whatever kind of funding we get at any point, but it did kind of put a little bump in the road for us this year as far as planning, trying to expand. So even though we have 70 sites, there's still a lot of small communities that we had plans to open clinics or open dental centers in, and those plans had to be kept on hold until the funding got settled out. So it was quite a year. It was quite a year for all of us.
Absolutely.
Yeah.
Worst case scenario, if Congress were to completely cut funding for community health centers, what would that mean for the citizens in Montana and, other states in the nation?
Yeah, I think it's really, as we all get more informed about healthcare across the United States, at whatever age we are, we come to understand that that provider and that team that works for us is a part of our life, and we really rely on them. So in rural frontier areas, some of the communities only have community health centers to go to for a clinic, right? Their clinic is a community health center. So if that funding would become severely limited or cut all the way, many of the rural frontier sites would end up closing. So people that live far from our bigger cities would really struggle in transportation, right? Trying to get to health care in a reasonable amount of time when they need it. So it's a big concern, especially in rural frontier areas. In bigger populated cities, not in Montana, they have pockets where people have not had health care. So some places in their communities would go without that again. So certain special populations probably would not have access to care. So it's a pretty serious issue. The good news is there was a lot of bipartisan support, so this isn't a partisan issue, right? Healthcare gets a lot of support from both sides of the aisle. It just was, there was a lot of confusion in DC. It seemed like this year for them they struggled to get anything passed. So it was too bad that healthcare was one of those things that they struggled with.
Talk about the importance of community health centers for the children.
So access to care, as we know, is for everyone, especially for children. So what we saw with children, just like we saw with community health centers, is the CHIP funding. And in Montana, we have many of our people, kids that are covered by the CHIP program. So we are an access point for children, both on the medical side, on the dental side, and on the behavioral health side. So in our certain centers, you can have your baby there, you can get your prenatal done, you can have your children see their pediatrician, they can go to the dentist there. So all of those early childhood interventions in healthcare that make a difference when we're older. So research has shown that if you are taken care of when you're born, before you're born and when you're a baby, you will live longer better. So community health centers do a really good job in that access area.
Oh, that's great. Up next, we'll be talking about a community health center in Helena. Stay tuned. Welcome back. We're joined now by Dr. William Snyder, who is a physician at Pureview Health Center. Thanks for being on our show.
Well, thanks for having me.
How many people does Pureview serve?
Well, Pureview Health Center serves over 7,000 people in Helena and Lincoln and parts of Broadwater and Jefferson counties.
What does Pureview mean to the folks that live in Lincoln?
Well, Parker Medical Center in Lincoln serves the community, the surrounding community, and it's open 8 to 5, Monday through Friday. It has a provider, nurse practitioner, Laura Broussard, and really, I think, allows the community to be successful. I mean, if you're a community like Lincoln and you don't have a clinic, then folks who have chronic medical problems, seniors, or families really have to drive over 60 miles to seek care. And it would be really hard to live in a community if you had to do that.
I understand Pureview is a patient-centered medical home. Can you tell us, what does that mean?
Well, patient-centered medical home is really team-based care. So it's nurses, providers, care managers, case managers, dentists, mental health professionals, diabetes educators, pharmacists, really all working together for the patient. So a patient-centered medical home really allows us to move away from episodic care and more into proactive care. So episodic care would be sitting at home and thinking, I need to see the doctor. And you call up, make an appointment, come in, see the doctor. But really, besides that interaction, you really don't have much contact with your medical team throughout the rest of the year. You might go in once, twice, 3 times a year. But with a patient-centered medical home, particularly with folks with chronic medical conditions, we're going to be having proactive care. So we may have care managers reaching out to you to see if you have any questions, to make sure that you're up to date on your lab work and that you're getting the care that you need to get at the right time. So that's really what a patient-centered medical home is all about, is putting the patient at the center of the care and not the provider or some other resource. Patient-centered medical homes really improve efficiency, they improve patient outcomes, they improve patient satisfaction, I believe, and certainly save money, or more cost effective for everyone, for the patients, for all of us. The patient-centered medical home really is about the communication between all aspects that I mentioned and care coordination. And to be a patient-centered medical home, recognized, you have to meet certain standards, and I believe all the community health centers in Montana have met those standards. And for Pureview, we've met over 125 of those national standards that clinics like ours would need to meet to be an officially recognized patient-centered medical home.
Impressive. Many patients talk about how confusing it is when they go to the doctor, go to their practitioner, and they're given lots of verbal information, and then they're also handed a bunch of material. And it is confusing. So how does a clinic, healthcare system like Pureview prevent that scenario from happening?
Well, that's really all about being a patient-centered medical home and getting away from episodic care. So our team, our diabetes educator, our pharmacists can help answer questions, reach out to patients should they have questions, make sure that they're understanding what their medications are, why they're taking them, understand their chronic medical problems such as diabetes, and really try to go the extra mile to reach out, be proactive with patients for that education.
So you've talked about the patient-centered medical home and being patient-centric. Can you talk about a couple of success stories you might have seen as a result of this model?
Well, I see patients have success really every day with identifying and making lifestyle change or lifestyle modifications. It may be stopping smoking or cutting back on cigarettes or changing diet, losing weight, even just taking medications, committing to come to the clinic and come to the provider, talking to the resources. I think when you make these lifestyle changes, when you make the commitment, then patients come back, they see the success they've had on their own, using the resources from the patient-centered medical home to make these changes, coming back, they've lost weight, their blood pressure is better, sort of see the benefits of it. And I think the success really comes from the patients working with the clinic and with the medical home.
What is PureView's relationship with Lewis and Clark County?
Well, PureView is a department within the county, and we utilize the resources of the county to be successful for ourselves and for our patients. Although the PureView itself is a 501c3 not-for-profit clinic, we get a federal grant to see patients, but we are part of the county family.
So do you have a community-based board that oversees PureView?
Yes, our board is made up of 51% users or patients of the clinic, so that they really have a stake in the care that's provided and the success of the clinic, and they understand what happens at the clinic. The board helps set policy for the clinic. It helps establish the strategic direction and approves the budget.
How often does the board actually meet then?
They meet monthly.
And if, as a community member, I were interested in being on the board, in the time that we have left, what would I do?
Well, if you wanted to serve on the board, you could go to pureviewhealthcenter.org and see the information that's available there. You could contact our executive director, Jill Steele, and express your interest. I think she's always looking for people who would be dedicated and good board members.
Excellent information, Doctor. Thank you, Dr. Snyder, and I would like to thank Cindy Sturgar as well. I hope you at home enjoyed our show today, and we'll see you next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.